Welcome to sqadia.com, best video learning platform for medical students all over the world. So today we will be giving you a brief introduction to autonomic nervous system. Any systems of the body, for example digestion, circulation, are controlled automatically by the autonomic nervous system and the endocrine system. Control of the autonomic nervous system often involves negative feedback, and there are many afferent sensory fibers that carry information to centers in the hypothalamus and medulla. These centers control the outflow of the autonomic nervous system, which is divided on anatomical grounds into two major parts, the sympathetic system and the parasympathetic system. Many organs are innervated by both systems, which in general have opposing actions. The actions of sympathetic and parasympathetic stimulation on different tissues are indicated in the inner columns, and the resulting effects on different organs are shown in the outer columns. The sympathetic nerves leave the thoracolumbar region of the spinal cord, T1 to L3, and synapse either in the paravertebral ganglia or in the prevertebral ganglia and plexuses in the abdominal cavity. Postganglionic non-myelinated nerve fibers arising from neurons in the ganglia innervate most organs of the body. The transmitter substance released at sympathetic nerve endings is noradrenaline. Inactivation of this transmitter occurs largely by reuptake into the nerve terminals. Some preganglionic sympathetic fibers pass directly to the adrenal medulla, which can release adrenaline into the circulation. Norepinephrine and epinephrine produce their actions on effector organs by acting on alpha, beta-1, or beta-2 adrenoreceptors. In the parasympathetic system, the preganglionic fibers leave the central nervous system via the cranial nerves, especially 3, 7, 9, and 10, and the 3rd and 4th sacral spinal roots. They often travel much further than sympathetic fibers before synapsing in ganglia, which are often in the tissue itself. The nerve endings of the postganglionic parasympathetic fibers release acetylcholine, which produces its actions on the effector organs by activating muscarinic receptors. Acetylcholine released at synapses is inactivated by the enzyme acetylcholinesterase. All the preganglionic nerve fibers, sympathetic and parasympathetic, are myelinated and release acetylcholine from the nerve terminals. The acetylcholine depolarizes the ganglionic neurons by activating nicotinic receptors. A small proportion of autonomic nerves release neither acetylcholine nor norepinephrine. For example, the cavernous nerves release nitric oxide in the penis. This relaxes the smooth muscle of the corpora cavernosa via cyclic guanosine monophosphate, allowing expansion of the lacunar spaces and erection. Sildenafil, used in male sexual dysfunction, inhibits phosphodiesterase type 5 and, by increasing the concentration of cGMP, facilitates erection. Adrenaline mimics most sympathetic effects. For example, it is a sympathomimetic agent. Elliott suggested in 1904 that adrenaline was the sympathetic transmitter substance, but Dale pointed out in 1910 that noradrenaline mimicked sympathetic nerve stimulation more closely.